Welcome back, everyone. So we are ready to start the second part of our first session of the day. I welcome Anjana, Thampi, and Daisy May Barker to the panel. So unfortunately, our third panelist of today cannot join us. So we will hear presentations from Anjana and Daisy, and then we will go to comments by Ruth, Diane, and Sue. And then if we still have some time, we will open up questions to the audience. So if you would like to send in a question, please use the Q&A function in your Zoom. And we will then choose a few questions to direct to our panelists. So we are going to start with Anjana Thampi. So she's from Jindal Global University in India, and Anjana is going to present a paper entitled Understanding Declining Female Labor Force Participation in India Through Social Reproduction Theory. So Anjana, the floor is yours.
Thank you. Really happy to be a part of this very exciting conference. Let me just share my screen. All right. I hope you can see that. So I would be essentially trying to explain the declining female labor force participation rate in India and how we could try and understand that through social reproduction theory. So the context is essentially a puzzle that's been raised in quite a lot of literature of a declining female labor force participation rate in India since the late 1980s. And why it's been brought out as a puzzle is because usually when India is spoken about, one of the first lines that you see is that it's been one of the fastest growing countries in the world for a while. But in spite of that, there's been a declining rate in the female labor force participation rate. And if you can look at the graph on the left, the rural female rate, which is the orange line, which was at around almost 50% in the early 1990s, has been declining to half of that by 2017-18, whereas the rate for urban females has been roughly stagnant. And there have been quite a few explanations which have been advanced to try and understand this. One of them is that there's been, young women have been participating a lot more in higher education. And so they've withdrawn from participating in the paid workforce. And that does explain it to some extent, but not completely. Another explanation that's been relied on quite a bit is the income effect, that there's been rising real incomes of households over time. And women have sort of voluntarily withdrawn from the paid workforce. Now, this doesn't really resonate so well with, because it's not just in households that are, say, in the richest quintile that you see this decline. It's also noted in quite a few of the poorest households as well. And another explanation that's been placed is that even though there's been rapid economic growth, that the nature of that growth has not really been employment generating. So there's been a lack of employment opportunities, essentially. So where I start from is essentially this line that more complex factors are involved than has usually been discussed. And I sort of put out two critiques in terms of the conventional explanations that are usually taken in the literature. One is that when there's been this decline in the labor force participation rate, correspondingly there's been a rise in females engaged in social reproductive labor. And one of the few studies that have tried to look at this is, looked at this is by Naidu and Rao. And when I say there's a corresponding rise in this, it's in terms of how statistically sample surveys have tried to capture work, how in employment surveys there are these categories referring to whether they attended to domestic duties such as care work, and whether they were engaged in free collection of goods like vegetables or roots or firewood or water and so on, or sewing, tailoring, and weaving for their own household, which if someone else was doing it, that would be considered work. But when they're doing it for their own household, that's not included in the definition of work. And that sort of aligns with this line that capitalism only recognizes productive labor for the market as work. And there are a multitude of other life-making activities that reproduce the worker, which are not, in statistical terms, defined as work, but also, there's been feminist economists have for a long time been arguing for it to be included in the definition of work, but it also goes beyond that in terms of how such work is considered in general. And the critique that I'm posing is in terms of thinking of this as work, but also aligning this overall decline that's seen in the female labor force participation rate with a general withdrawal of the state from providing basic services. And that would include, particularly in the current context, we can think of the withdrawal of the state in terms of providing healthcare in the Indian context, which in recent years, there's been a shift to a health insurance-based model where that obligation towards providing health services is sort of diverted then to private healthcare providers, but also in terms of general infrastructural and other essential services that are needed for the survival of people and of the workforce and of the system itself. And this has been noted in studies which actually talk about a declining access to common property resources, which are, so the study that I've mentioned here is specifically in the context of the state of Andhra Pradesh, where there's been a nexus between the state and the capital to take over land and use that for private enterprises and so on. But how this reflects in terms of whether women might participate in the paid workforce is that when there is a decline in terms of the access to these common property resources, women then have to spend a lot more time and effort, or whichever household member is involved in it would have to spend a lot more time and effort just trying to get water for their or firewood or any of the other resources that are usually used in their household. And from this journalistic account by Sainath, where he's referring to the specific state of Maharashtra, which frequently encounters periods of drought almost every year, he's referring to advertisements for where each apartment has, for the construction of apartments, where each apartment has its own private swimming pool, in a state where thousands of villages depend on visits from water tankers, which might only be once a week. And he talks about how workers were actually involved in building and constructing those apartments belong to some of these villages which don't have regular access to water. And these are accounts which are specific to certain regions, but that's borne out by national level sample survey data, which indicates that 67% of the total population did not have access to piped water in 2018. And this water insecurity is, of course, itself a problem, but the effect of that is not really falling equally on all members of the household. And there are ethnographic accounts which point to the gendered impacts of water insecurity, in that it's often the female members who have to then go and either go to travel quite long distances and spend quite a few hours in the day. It has been in certain regions around 2 hours or 6 hours in a day to collect water for just their daily use. But also, this is again sort of borne out by the national level data, which indicates that in 76% of the rural households and half of the urban households where water was not really available within their premises, it was a female household member who had to fetch water. So here I'm specifically referring to water as sort of one indicator of social reproductive labor, but of course it would apply to a lot of other kinds of activities that have to be undertaken for sustenance. The second sort of critique that I want to make of the traditional approaches towards explaining the decline is that it's usually spoken about in terms of applying to all females. And with respect to this line, that like race elsewhere, caste is terribly important in terms of explaining not just labor, but actually pretty much everything that you could think of in the context of India. And there have been studies which have tried to look at the persistence in horizontal inequalities in various economic parameters like income and wealth and so on. And what this graph here is showing is essentially the rates across communities. And the blue line is referring to scheduled tribes, tribal communities. And the orange is with respect to scheduled castes. Those are the formerly considered the untouchable communities. And the other backward classes and others are sort of the residual category, which don't fall into those. So the first three would sort of be considered the historically disadvantaged social groups. So the point is that, as you can see, even though there's been a decline across social groups, the pattern of that decline is slightly different, as well as the rate itself is different, which can be identified with general economic situation of these households as well, because the tribal households that belong to the tribal communities are often far more economically disadvantaged than the forward caste communities. So just to raise the point that the explanation itself may be different across females who have different social identities. And this can again be put together with that point with respect to access to water, because when there is limited access to common property resources and to essential items that you might need, like water, then just that limited access itself is likely to be differentiated by your caste and by your identity. And this is historically true as well, in terms of one of the earliest struggles for the scheduled caste communities being one of where they were struggling just to have access to water from a public water tank, because they were not allowed to access it otherwise, because their use of it, which is considered to be polluting. So this is with respect to the labor force participation rate and why differing access to water might influence whether women might be able to participate in the paid workforce. Also, to add to it, an additional insight social reproduction theory as a framework would give is that even the women who are employed in the paid workforce are often employed in activities that would come under life-making activities like in subsistence farming or in healthcare or in education or in domestic services. And these services, this work that they do is essentially helping to support the system and support the survival of the workforce and of people. So to sort of summarize these points, often the decline in LFPR is not really seen along with that corresponding rise in reproductive labor, but there's a striking need to try and understand them together, and a need to redefine work itself, but also within that context of the withdrawal of the state from providing basic services. And to add to that, that the dominant explanation may itself differ by the social group and the identity of the females, which would be enhanced. So this overall pattern and the understanding of that would be enhanced by understanding the forms of oppression that are in place. Thank you.
Thank you very much, Anjana. So now we're going to give the floor to Daisy. So Daisy May Barker from the University of Lancaster in the UK. And Daisy is going to present a paper entitled Mothering the Crisis, an exploration of the experiences of mothers working from home in lockdown during the COVID-19 pandemic.
Thank you. Hi, everyone. I'm just going to turn off my video whilst I share my screen, because sometimes my laptop gets a bit angry when I put them on together. Great. Can you all see that? Fabulous. Right. Okay. So I just want to say I've really enjoyed all the presentations this morning. They've been absolutely fantastic. So hi everyone, yeah, I'm Daisy and I'm a first year PhD student at Lancaster. I'm only 1 month in, and today I will be presenting the research I completed this summer for my sociology master's dissertation. And the central aim of this research was to document and analyse the experiences of mothers working from home during the first national lockdown in the UK. It seems strange having to specify it was the first, now we're in our second. So a bit of background. My research aimed to address a gap within rapid response research that considered how lockdown had impacted our working and domestic lives. Particularly, this research found that the shift to working from home had disproportionately impacted parents due to the closure of childcare and school facilities, which had led to an increase in domestic and caring responsibilities for them. However, despite a lot of this survey research reporting that mothers were taking on a larger share of these domestic and caring responsibilities, very little research, apart from obviously the brilliant stuff from the Women's Budget Group, actually focused on their experience of this. So I wanted to enhance the brilliant quantitative data that was coming out about this from a qualitative perspective. So I sampled 6 mothers from my personal networks, and this meant that the women were largely middle class. However, I managed to get mothers who were of different ages and ethnicities. And also I managed to recruit mothers who were of different occupations, number of children, and then children themselves were of different ages and abilities, and other dependents such as elders. So I interviewed each of these 6 women informally, in which the interviews took place as sort of a guided conversation in which they shared their experiences with me in their own words. They took place online within the June to July period due to social distancing measures still being in place at this time, which made the participants feel more comfortable. And this produced a wealth of empirical data for me to analyse. Social reproduction theory seemed like an obvious theoretical framework for me to analyse my empirical data, due to how I was interested in how lockdown was impacting mothers' working, domestic and caring lives. Therefore, adopting this labour lens that social reproduction theory provides us enabled me to integratively analyse productive and reproductive labour. This form of analysis was of crucial importance to my research, as within lockdown, the shift to working from home meant these 2 forms of labour were more integrated now more than ever within one space of the household, which obviously feminist researchers have forever critiqued the sort of separate spheres ideology that we face. However, I want to briefly mention that my theoretical framework also included some historical analysis, in which I proposed the importance of understanding how mothers' productive and reproductive labour has been impacted by different forms of socio-economic and political crises throughout history, in which I selected 3 that I thought were particularly significant: post-World War II, the shift from Fordism to post-Fordism, and austerity, and of course the COVID-19 pandemic. From this historical analysis, different forms of crises through social reproduction theory, so adopting this labour lens, 4 important patterns of emerged across this that helped me analyse my empirical data. So firstly, I found that women's productive labour fluctuates within times of crisis. By this, I mean it depends on the specific crisis we are facing, but they tend to quickly move in and out of the workforce. And this happens in different ways. So for example, at the moment, the COVID-19 pandemic is unlike any other crisis we've seen in this respect, due to how the sectors hardest hit by lockdown, such as the service sector or the childcare sector, disproportionately impact employed women. And then secondly, women's productive labour often changes location in times of crisis. By this I mean it often moves into the home for some women, particularly middle class women. And this is to cope with structural childcare issues. So an example of this, within the shift from Fordism to post-Fordism in the 1970s, which saw the expansion of clerical work and women moving into the service sector, it was encouraged at the time through the advance in technology for women to partake in something called teleworking. And this was particularly promoted to women to deal with the second shift of reproductive and productive labour. So that was really important for sort of understanding, you know, this sort of first move to working from home. And then the 3rd and 4th patterns are quite interlinked. So I found that the political economy of social reproduction is often reconfigured in times of crisis, and particularly the state's involvement in this. And by this, I mean the institutions and networks of individuals involved in providing reproductive labour. and how the state often removes its input from this. So, for example, the Women's Budget Group has been fantastic for documenting how the COVID-19 pandemic has collided with the social reproduction crisis caused by austerity as a political form of crisis. And this disproportionately impacts women's labour, reproductive labour. So overall, these form patterns that emerge from this historical analysis through a social reproduction theory lens enabled me to see how crises only expose and exacerbate pre-existing forms of inequality. So the first empirical chapter in my dissertation, I focused on forms of lockdown-specific reproductive labour that my participants performed that are well summarised in this abstract from Gemma, which I shall now read out. I am like a stay-at-home mother, but I am also working full-time, if that makes sense. There is an expectation that I should do a larger share of housework, childcare, homeschooling, and generally keeping everything and everyone in check, because I am at home more. We have taken on more traditional roles unintentionally. So what Jem is describing here is obviously not only the increase in normal forms of reproductive labour that she was completing before lockdown, but also taking on new forms of reproductive labour. So firstly, a lot of my participants documented the shift to homeschooling due to obviously the closure of schools during lockdown. And this was predominantly performed by mothers within my study. And this meant different things for women with children of different ages. So for those with younger children, they stressed the need to do developmental childcare, such as reading books and puzzles, which would usually be done during the daytime nursery. And those with older children said that it was quite stressful trying to manage their homeschooling schedules and actually make sure they were doing something. But also, this homeschooling was fraught with class anxieties. As we mentioned previously, schooling is a big part of social reproduction and reproducing the system. So a lot of these women actually were really worried that now that their children were no longer going to extracurricular activities, they worried they weren't getting that enrichment anymore. So secondly, emotional labour. Again, this is something that happened before lockdown, but took on a different meaning in lockdown due to the emotional toll of the pandemic, the uncertainty that it caused, and facing the daily death toll at this time. Many of the women stressed that this was the most stressful form of reproductive labour that they not only performed for their children, but also their partners, and it really impacted their own mental health. And lastly, the last form of lockdown-specific form of reproductive labour that I focused on was women taking responsibility for lockdown management. I found this a really interesting finding and something that otherwise would be quite hidden within the household. Many of the women that I spoke to stressed the importance of taking responsibility for lockdown. And by that, I mean they did different things at different stages of lockdown. So, for example, within initial stages of lockdown, many of the mothers stressed that they felt the need to research and source medicines in case one of them contracted the virus within their house, as they felt, as they were working from home, it would be their job to try and manage it. So theoretically, I considered this to show how these forms of reproductive labour within the household that were predominantly performed by mothers was due to the collapse of the political economy of social reproduction at this time. And by this, I mean that the labour that was usually completed by different institutions such as the school or childcare facilities and informal networks of care such as grandparents or outsourced to cleaners collapsed into the home, and this disproportionately impacted mothers. So within my second empirical chapter, I considered how my participants' productive labour was impacted by their increased reproductive labour whilst working from home. And once again, this was really enabled by this intricate analysis that the labour lens of social reproduction enabled me. So I focused on three main ways that are perfectly narrated by Sunita in this extract, which I shall now read out. My performance and productivity levels that I tracked at work have gone down because I can't concentrate the same due to doing longer hours and working next to my daughter. My job sometimes involves really intense levels of concentration and I get distracted. And as you can see from this extract, she gets quite emotional saying this. I feel awful when I say that because my daughter isn't a distraction. She's my world. I feel like an awful mum. So many of my participants described the different ways in which they had to try and move their productive labour into the home, obviously whilst dealing with the increased reproductive labour. And one of the main issues they stressed was having to get a new working schedule. So many participants had to reorganise their working day to facilitate completing the productive and reproductive labour. And this meant trying to both integrate it and separate it at different points of the day. So many of the women said that they worked very early within the morning before their children woke up, some saying that they woke up as early as 4 a.m. to try and get in a shift of work before their children woke up. And then they would try and do a bit of work throughout the day with their child. And then once again, late at night, they would work whilst their child had gone to bed. So this feeds into the next point about working space. To facilitate completing both productive and reproductive labour within the household whilst working from home, many of the women said they had to be mobile around their house in order to manage these two things concurrently. So this meant they had to, work alongside their children with their laptop, often either setting their child a small workspace next to them in their office or moving with the child around the house. And then thirdly, this sort of, brings together sort of the reproductive chapter and what I'm just talking about now. The mother's work tended to be largely interrupted in lockdown due to, the increased amount of work they were trying to do, both reproductive and productive. And this left them feeling both unprofessional as a worker, but also guilty as a mother. And it was like, they really stressed that the way they were working during lockdown at this time was really unsustainable. And it really impacted, how they were thinking about their future and stuff like that. So the conclusions I drew from this was firstly, I hope that this overview of my dissertation has somewhat shown how social reproduction theory provides a useful lens for considering how the crisis of the COVID-19 pandemic is impacting our working and domestic lives. But ultimately, the findings of my research consider how both the collapse of the political economy and the spatial separation of the workplace and the home are intimately linked. And this is disproportionately impacting mothers' productive and reproductive labour. And obviously now the political economy of social reproduction and the spatial separation between the workplace and the home is collapsed. It is collapsible, and this is sort of what we're seeing now with this second lockdown and the move back to working from home again after some easing of restrictions. My historical analysis enabled me to consider how the impact is not only the impact of the COVID-19 pandemic has sort of exposed and exacerbated pre-existing inequalities. And my PhD research, although I'm only 1 month in and it's still very much up in the air, aims to extend this research that I've done and further consider how COVID-19 is impacting the political economy of social reproduction by exploring different institutions such as the household, the school and childcare facilities. Thank you. I think that's everything.
Thank you very much, Daisy, for a great presentation. So what we're going to do now is we're going to hear some feedback and some comments from Ruth, Diane, and Sue. And then we might have some time for the presenters to reply back if they wish. And we will then open up the floor to questions from the audience. So people who are listening in, if you want to pose any questions, you can just go to the bottom of your Zoom screen and you will have a Q&A function where you can submit your questions, and then we will ask them of the participants. So shall we start with Ruth this time? You're on mute, Ruth.
Sorry, did you say I should go first?
Yes, please.
Sorry, because it keeps freezing. Right, okay. 2 really interesting sets of paper, which are very complementary. But, you know, and there are lots of parallels, but there are also quite interesting differences, which I think are worth noting. So in Anjana's paper, I thought it was really fascinating, this decline of female labour force participation, even in the context of rising income. And, you know, clearly, you know, the major explanation that you put forward was the increase in social reproductive labour as the state has withdrawn from the provision of resources and services for reproduction. I mean, very much on a different scale, like the situation that I found in Cuba. And I think, you know, and the other thing I thought was really fascinating about your paper is it really exposed the implications of the fungibility in the notion of work and what is reproductive work and what is productive work, and how those boundaries shift enormously. I thought I mean, again, you know, the issue about water was very interesting and had, you know, echoes of the earlier paper on utilities indebtedness. But yeah, it's hard to kind of assimilate everything so quickly. The breakdown of the labour force participation between different groups and castes. I mean, you didn't have time to go into that a lot, but I also think that's very interesting because the direction of travel was similar. And, you know, given, you know, we've seen in other research of India, these contradictory issues, like when the increase in GDP, I mean, the growth in GDP, you get an increase in masculine sex ratios, and that's one of these contradictions. I mean, also you've got the increase in dowry as income has gone on. So, you know, India is really fascinating in terms of explaining these apparent contradictions when everybody assumes that with economic growth, these things would go in a different direction. So I'd really like to read some more about this research. And Daisy's paper, again, is clearly showing that there is a breakdown in the reproductive bargain in the context of crisis. And one of the interesting contrasts between these two papers is that in the UK, the women's reproductive work and productive work is intensive, well, goes on at the same time. The increase in reproductive work doesn't reduce women's productive work, but makes it very difficult for that to be sustained. And I think we've seen in some of the statistical analysis that actually women's employment rate is actually dropping off because of that increase in responsibility. And of course, now with the second lockdown, we don't know where we are. I mean, I think it might be interesting if, I mean, not your research, but if somebody else or in your PhD research, you have an opportunity to look at what's happening in households where women are essential workers and have to leave home to go to work, and the extent to which childcare and household reproductive work impacts that, because I think that's, you know, you said you only had the opportunity to look at sort of middle class sort of samples who were doing the kind of work you can do at home, and clearly computer based and things. But I mean, it might be interesting to look at what happens in other circumstances. But I thought your research also was very of the moment, and also shows what a political challenge it is for feminist economists who want their work translated into policy to have any impact in the kind of recovery policies that governments in different contexts are you know, are considering. Anyway, I'll stop there. I might come back later.
Thank you very much, Ruth. Diane, would you like to go next?
Yeah, sure. Two very interesting papers, I think. At first, I'll start with a concept they both used, which was reproductive labor, which Anjana defined, I think, as domestic duties and a kind of range of subsistence production, of which water gathering was an important one, but also producing clothing for the household. And Daisy talked about productive and reproductive labor, although Daisy didn't really define either of these. And I was thinking that maybe the way you were defining reproductive labor was different from the kind of definition that Ella used earlier in her paper in the earlier section, because implicitly, I think you were defining reproductive labor as unpaid labor in the home. Whereas Ella, I think, was considering paid care work as reproductive labor as well as unpaid care work. So that's just an example, I think, of the different ways people define these concepts and the importance of making clear and why. I mean, I think there's arguments on both sides for how one would define reproductive labor. And then, of course, when we're focusing on water, I think, and John, it was really interesting to focus on water. And when water is collected on an unpaid basis in the home, yeah, we call that reproductive labor, and we call that contribution, an unpaid contribution to social reproduction. When it's water engineers who are providing it on tap, we don't call their work reproductive work. And I think it's worth pondering on why we don't. But in terms of the specifics of your paper, Anjana, I think it would be good if you had some data on trends in water. I mean, you've got this trend in the labour force participation rates for all of these social groups that you showed. Do we have any data on trends in water? I know there's a new time use survey out for India now, which might be a resource and could be contrasted perhaps with earlier time use surveys that have collected data on water. So it'll be interesting to know. We know there's a lot of people who don't have it, but has it got worse? Has it got worse? Are women having to spend more time because they can't access water resources close to home now because of the enclosure of the commons? Because there are fewer women in the household to do this work, given what's happened to the sex ratios, given there might be more demand for water because people might have imbibed health messages and want to spend more water on hygiene. So it would be good to unpack these different reasons for this and whether you can show any trends in this. I think that would be really useful. And I think also that declining access to the commons is a really important issue, which is not something that we think about really when we're thinking about social reproduction in an industrialized country, because long ago the commons in terms of natural resources were mainly enclosed, but clearly it is very important. And I think being able to make a closer connection. Does this mean you've got to work farther for water? Does it mean that the water you get requires more time to purify it? Because that's another aspect of the time spent on water. And also, I think the commons, the enclosure of the commons might also be implicated in the declining participation in production for the market. Because as I understand it, those commons are not only used to get subsistence goods, they're also things that you can also sell. You collect firewood for your own home, but you also can sell it to other homes, nuts, fruits, etc. And that might also be implicated in these rural women's declining participation rates, because they also used to use the commons for products that they could sell, and then probably they might be counted in the labour force survey as participating in the labour market. But I was really glad to see that focus on water, because one of my things in these discussions about unpaid work in outside of Europe and North America and so forth. I keep saying, what about water? You know, care is important, but water is probably even more important. So I think that was very good to see that focus. And Daisy, really interesting work. And I'm reminded, of course, when we're thinking about India and other countries in Asia and Africa and Latin America and our own historical past, actually this physical separation of the productive and the reproductive labor is a new historical phenomenon. And it doesn't happen. Lots of women around the world are doing home-based paid work and minding their children as they operate their sewing machine, for instance. And so it's a composition of a kind of relationship, spatial relationship between productive and reproductive labor. In the UK, that used to happen in the 19th century and still happens in many, many other places around the world. And with that, I'm wondering whether it's the homeschooling that is the really key thing. And now that the schools have opened again, how much difference that is going to make to these intense tensions and burdens of trying to combine the two. So I do think you're right to say that more home-based work is here to stay. And that's got its own dangers because it's using technologies that allow a lot of surveillance of the worker at home in the way that home-based sewing does not. Home-based use of the computer allows for a lot of surveillance of workers. But maybe now that the schools have opened again, that intensity of caring for your children at the same time as you're on your computer has diminished a bit. But it's this ways in which work is spatially, both paid and unpaid, being reconfigured, I think is a really important thing to look at. Thanks.
Thank you very much, Diane. Sue, would you have some suggestions and feedback?
Well, an awful lot has been said before, a lot of which, nearly all which I agree with, but I just thought both these two papers were sort of model examples of how the concept of social reproduction can be extraordinarily productively used to analyze very different phenomena. And in particular, I'm sorry, I've got your name covered up, Anjana. I thought that you were giving a very good example of the thing that I got out of the second reference that Diane gave this morning, which was to a paper by Humphreys and Rubery. And I remember at the time, I found it really interesting because it pointed out that the normal ways of talking about that whole area called social reproduction is just as either as something completely fixed, that, you know, norms that cannot be transgressed, you know, that the economy runs on, you know, what men do, what women do, or that it's completely a recipient of changes that go on in the economy. And what they pointed out is that you have to see the two dynamically as interacting. And your paper is a perfect example of that, I thought. So I think it will be really, really, really interesting. I have just one comment about a way of looking at something, which is when you showed the sort of parallel lines that happened across the different castes with respect to falling female labour force participation. I wonder whether, instead of stressing that we have to look at it differently for each caste, which I'm sure you might well want to do, but what I got out of that was much more that it shows that that unequal access to water can be seen as part of the way in which caste is socially reproduced. So that using the language of social reproduction might actually be a helpful way of exploring those differences and the way those differences themselves are in it. I mean, they're not just differences, but the hierarchies are reproduced. But I think this is really, really exciting work. And we'd be very keen to know how it goes on. Daisy, my suggestions on what you should do are very similar to Diane's. I was struck that you first introduced it about working from home, but it struck me that actually what's going on is the fact that the social reproduction is going on at home. You talk later on about the separation between home and workplace, but we've also had a separation of the workplace from the social reproduction place. And maybe that's what's being challenged. And I wondered whether any of the mothers you interviewed were ones who had been working from home before the pandemic. Is it just those, what about people who used to work from home, but did it in peace and quiet and now have their children around them? And that I think might be also interesting to explore, because at least for younger children, it seems to me it's the fact that the children are around when you're trying to work that's it's actually for both of them, you have no help with the social reproduction side of looking after those children. That's what's happening. With the older children, it may be that you are now at home at a time that they would have been at home anyway, and are sort of distracted by norms about how you ought to be behaving to them. If they would have been at home anyway, in theory, maybe it shouldn't make so much difference to you, but clearly it does, and we all understand why it does. So I think it's in some sense the core of that, which it is actually how you talked about it, but not how you introduced it, is about that withdrawal of reproductive support. And just what Diane's comment made me think about is that one of the differences between what's happening now as a crisis response in a pandemic to a previous era in which lots of women worked at home and looked after their children at the same time is that the norms of social reproduction have changed. So that mothers are more likely to feel they have to give full attention to their children now, rather than that all this has to be, muddled in together because it grew smooth, and what we've had is a rupture, and that's an interesting sort of thought, a natural experiment, if you like, in what's going on now, and making use of the fact that we've actually had a rupture in social relations, not just a change, if you like, might be quite interesting.
Thank you very much, Sue. So before we open up the floor to questions from participants, I would just like to give Daisy and Anjana the opportunity to reply to any of the comments or reflections that Ruth, Sue, and Diane provided. So if you would like to respond, please feel free to do so now.
Can I start? Thank you so much for those very insightful comments. As Ruth pointed out, that contradiction in terms of the nature of the growth, the rapid growth, and a lot of the different patterns that have been found in the Indian economy are extremely relevant, and particularly so in terms of just the nature of employment. That it's not been as employment generating as you might expect. And also that the employment opportunities that have been generated have been largely informal in nature. So that what's been noted is that around 90% or more than that of the paid workforce are informally employed with very precarious working conditions and low wages and so on. And so that itself, in other contradictions as well, are something that can be related to the social reproduction framework. Diane's points, several points that be very useful in how I explore these results. Right, that the time use survey has recently been released, the unit level data as well, and it would definitely be useful to look at the trends, and that would sort of help to substantiate what I'm trying to say, as well as in terms of access to commons, and that would definitely be useful and something that I'll explore. And Sue had mentioned how the hierarchies get reproduced in terms of this access to water, and that itself is also extremely interesting in terms of, I think, how I could try and sort of see that is in terms of just the historic patterns in terms of access to water, how that itself has been differentiated by caste, and as you sort of rightly pointed out, that in terms of how the access to these resources is self getting sort of exacerbating those divisions that are already exist. So thanks very much.
Thank you, Anjana. Daisy, do you want to go next?
Yeah, thank you everybody for your really helpful comments. Firstly, yeah, what Ruth was saying about, sort of the reproductive bargain and sort of, maybe with my PhD expanding my study to look at essential workers, that is something that I am planning to do. And I think that will, really be able to get like a variety of experiences, and it'll be interesting to see, especially in households where the mothers are the essential worker and maybe the father has worked from home or something like that, sort of how the division of labour gets changed within those experiences. That will be really interesting. And Diane, yes, I really welcomed your comments about defining, reproductive labour. I find that's something that's really hard to do, and it's really hard to do in such a short space of time as well. But yeah, I think it's, it's really important sort of, especially with it being, a concept that's used in so many different ways and it's got such a history. It is really important. And then we can obviously show how we're trying to expand the concept as well through, this new time that we're facing with reproductive labour, as I was trying to sort of show. And obviously it is in an unpaid and paid capacity, which was really important in my research, because it was sort of the shift to sort of some of the reproductive labour that, because my participants were middle class, they did outsource to cleaners and, and childminders and stuff like that. And it was sort of those no longer being possible due to social distancing, and them having to take on that labour in an unpaid capacity. That was, really interesting. And as well, what Sue was saying about sort of, how expectations around reproductive labour has changed over time. That was something that I did look at within my dissertation, and sort of, look at how the stresses around sort of the idea of intensive mothering, those come up a lot within my research. And as well, what you were saying about people who had worked from home before, it was actually two of my participants had worked at home before. One, she was a fitness instructor and she worked from home during her office, but during COVID had to also do the fitness lessons online, which was, I'm sure, would have been very interesting around children. And another worked from home in her, she had an office-based job and worked from home a few times a week before COVID. But obviously both of those experiences were completely changed because they both had really young children and they had to obviously care alongside. So it was that had obviously changed their experience. But yeah, thank you for all your comments. It's really helpful, especially as I'm trying to, develop my PhD research at the moment.
Thank you, Daisy and Jenna. So we have a couple of, I've been keeping an eye on the Q&A, and we've had a couple of questions. So they're both for Daisy. I'm going to ask them at the same time, and then Daisy, if you'd like to give a reply. So Susie Hay, she has a question about domestic violence and abuse. So she's asking, I was wondering, did any of the women you interviewed advise of increased levels of pressure from their partners, or an increased level of domestic violence and abuse, balancing relational expectations alongside the areas that you explored? And then the other question is from Emily Marseille. So she's asking about the tensions between reproductive and productive labor that, that are a feature of capitalist society even before COVID. She asks, you and your presentation highlighting how unsustainable this contradiction between social reproductive and productive labor is. I would like to know what you would envisage the impacts of this to be in the long term. Do you conceptualize it as a contradiction of capitalism? And if so, how might it lead to us moving past our current economic system or towards a different way of working in the future?
Thank you. I welcome both of them comments. They're both really interesting. So firstly, the one about domestic violence, obviously, sadly, that is something that has increased during COVID and lockdowns. And that wasn't something I particularly found within my study, but it was something I was aware of. And some of my participants obviously noted an increase in sort of conflict within the household surrounding, you know, roles and stuff like that. But no, not domestic violence. They just sort of, it was particularly a pressure upon couples that both worked from home together, in sort of instances where they obviously were both trying to adjust to this working from home alongside taking on an increased reproductive role, in which there was conflict around the female taking on more of that labour, even though they were both trying to adjust to that. So that was an interesting finding, but that's something that I will be aware of in my PhD, sort of, you know, the increase in domestic violence. And the second question, sorry, what was that about how we could envisage the future as something, sorry?
Yes, so it's about the tensions between reproductive work and reproductive work that are sort of a feature of capitalism, and how it might lead us to move past our current economic system or towards a different way of working in the future. So it's really about whether you have explored this issue already in your research, or if you plan to do it.
Oh, right, okay. Yeah, well, that wasn't something I necessarily explored within my dissertation, but obviously it is something I'm opening to explore in my PhD. But yeah, I just found it was really interesting how lockdown provided us with a time to sort of, you know, understand how these productive and reproductive labour are very integrated, because they were now in one household. So it's sort of now, obviously, reproductive labour, you know, it falls predominantly within women within the household, and it seemed to be more apparent when the women within my study, now they're no longer getting their children ready to go to school, but are getting them ready to go to school and then doing the schooling themselves. They sort of understood that a bit more. So I think, you know, I feel like amongst the women that I spoke to, there's a raised level of consciousness about that. But I've not really thought anything about a system past that, but that's something I'm willing to explore within my PhD.
Okay, thank you, Daisy. So I've spotted two other questions that people have posed in the chat. So one of them is from Sally, and she's asking if you've considered interviewing men, and if not, why not? Cool.
I didn't for my dissertation, purely because obviously there was time constraints and stuff like that, and I was really responding to this rapid response research that sort of stated that there obviously were these differences within this increased reproductive labour, but there wasn't very much qualitative research that were getting women's voices of sort of the experience of taking on this increased reproductive labour. But within my PhD, I would be really interested in interviewing men and women, because obviously it's affecting everybody in different ways. So yeah, I will be interviewing men within my PhD research.
Thanks, Daisy. And we have one last question so far that was asked in the chat earlier. So this is from Laura Hamilton, and she was asking, Daisy, have you considered the impact on women as children are sent home from school to isolate during acute outbreaks? So not just during the official lockdowns, if we will, but also during when children are sent home because there have been outbreaks in their classes or in their schools.
Yeah, I spotted that in the chat, and that is a really great point. As I was sort of concluding my research within September and writing it up, we were during that period where we started to, you know, see the move back to schools and sort of that sort of isolation period that was, you know, triggered by people getting COVID within schools and stuff like that. And that's something I found really interesting. That was sort of, you know, one of the things that I sort of left on is, you know, the political economy of social reproduction, which involves schools and stuff like that, collapsed within lockdown, but now it remains collapsible, and sort of how that will impact women as they sort of, you know, have to. A lot of my participants sort of said they were working from home for the foreseeable, but that was something that would really worried them, that if they could have to quickly, you know, move back to doing the homeschooling whilst working from home, and how that would impact their career in the long term. So yeah, that's something I'm definitely going to document within my PhD, but something that I didn't manage to document within my dissertation, but that's just one of the realities of doing sort of real-time research.
Thanks, Daisy. So it seems there's no more questions from the audience. So what I'm going to do is ask people if they have any final comments or any final reflections to share, and then we will wrap up and break for lunch. Diane? Yeah.
Okay, just one final thought, particularly arising out of Daisy's paper, which is the role of the state education system. And see, I would definitely want to count the teachers as part of the sphere of social reproduction and their work as reproductive labor, and say what you've got here is a kind of switch between reproductive labor via the state education system and reproductive labor via homeschooling. So it's a kind of reconfiguration within your category of reproductive labor, from one that takes place through the state to one that is paid, and one that takes place in the home and is unpaid. I know there's been a lot of discussion in the chat about voluntary organizations and community organization. I think that's very important, but I also think the role of the state is also very important to bring into this discussion. And also in Anjana's, when it's the state kind of withdrawing from responsibilities it had previously said it would undertake, although it still hadn't, even when it said it would undertake them, it still hadn't succeeded in providing those services and infrastructures to millions of people in India. But at least there was some kind of commitment that the state would try to expand this provision, and now it's withdrawn from that. So, and that's withdrawn because of the particular, I think that you agree with me, Anjana, the particular form of capitalist development that India has adopted, which is very much a kind of private sector with the shopping mall as the emblem of modern development, not clean water provided by the state for everybody. So it's particular decisions and choices. But I think this issue of the role that the state plays or doesn't play, and how it changes over time, and the way people struggle about the role that the state should play and shouldn't play, is very important to keep in mind when we're thinking about social reproduction. So we don't just think of it as an interaction between the home and some paid workplace outside, or maybe even in the same space as the home, but we also bring the role of the state into this. And I have to also share with you a lovely new phrase I got from reading something from Nancy Folbro, which will be published in a book, certainly, where she kind of concludes by saying, well, what a lot of this is about is, although capitalism may be manly, it's not self-sufficient. And I love that way of kind of summarizing it. You know, there's a lot about capitalism that is manly in the sense of macho and a male dominated and system, the inequalities that we heard about in the earlier papers in the financial sector, for instance, but it's not a self-sufficient system. And I think it's because it's not a self-sufficient system, there are those cracks where ideas about a better system can get some foothold.
Thank you, Diane. So Sue and then Ruth.
I would just like to, well, question a bit that what Diane said about, you know, what's gone on in the pandemic, about a shift of reproductive labour from one sector to the other, because as a mother, a teacher, I know that teachers have been working incredibly hard through the pandemic. So I think I think a better way to characterize it would be that what we've had is a as I said before, a rupture in social reproductive relationships, and that has led to the need for a hugely greater amount of reproductive labor, if you like, because the system isn't adapted to our new ways of working. But I think, you know, the idea that, I mean, I know this from having worked at the Open University for many years, if you have to produce material to use online as well as face-to-face, it's incredibly hard work. And teachers, so I don't think what's happened, it wouldn't be quite right to say that, you know, these key workers have had less to do as a result of what's going on. The nature of their work has changed. And there's been an intensification of reproductive labour, I would say.
Right. Right. I'm not going to argue with anybody. I just want to pick up Daisy's point. You had this quotation about this mother saying that she felt guilty because, you know, the problem was the child, but the child was her whole life. I think that's how you. And I think that contradiction's really, that tension is really interesting. But also, I think that we have to, when we think about this, you know, change or this rupture, we really have to think about it in class terms. And I remember from some work that we did with the Home Workers Organization in the UK, there was this quote from a woman who said, the best part of working at home, I mean, she did sewing and stuff, is that you can work and look after the children at the same time. And the worst part of working at home is you work and you have to look after the children at the same time. And I think these tensions continue, but they shift in terms of changing context and crisis.
Okay, thank you very much, Ruth, Diane, and Sue, for your insightful reflections. So what we're going to do now is we're going to wrap up this first session of the day. We're going to break for lunch, but before we do so, I just would like to let participants know that at 12:55, we have a session which will be a networking session, which is optional. So if you would like to join us for a sort of quick introduction to everyone who's attending, so to sort of mimic a little bit the what will be the normal conference environment of lunch break, where people meet each other and share what they're doing and their research. So if you would like to attend that, Anna has just shared the link for that session. So you're very welcome also to bring your own lunch and join us in that. And then at 1:30, yes, 1:30, we are going to begin our afternoon session. You will have your links in the program, so please feel free to join us then for both or either of these sessions. So a big thank you for all our panelists, and to Professors Ruth, Diane, and Sue for their helpful feedback. And yeah, I hope it was helpful and an enjoyable session. And we'll see you at 1:30. Take care, everyone.